Prescription drugs are misused and abused by various routes of administration, but most commonly via the oral route. Although most abusers start by ingesting a formulation intact, many progress to more advanced methods that are intended to circumvent the tablet's intended release properties and speed the release of drug to produce a faster and stronger euphoric effect.
Here at DRUGSCAN, we have developed dozens of protocols and conducted thousands of experiments evaluating investigational product candidates that are formulated with abuse-deterrent properties. We have experience with all types of abuse-deterrent technologies, such as those with physical and chemical barriers, agonist and antagonist combinations, prodrugs, and new chemical entities. Our Category 1 testing suite typically incorporates physical manipulation studies, large volume extraction studies, liquid-liquid extraction and precipitation experiments, simulated smoking experiments, as well as a variety of small volume syringeability and injectability studies. At DRUGSCAN, each Category 1 study is individually tailored to fully characterize the abuse-deterrent features of a new formulation and provide adequate information for regulatory review.
Abusers may attempt to extract the active pharmaceutical ingredient from extended-release opioids after physical manipulation in ingestible solvents prior to administration. Alternatively, many abusers simply chew the tablets prior to ingestion because chewing does not require the abuser to use any tools or solvents for extraction, and abusing the drug in this manner can be done anywhere, like at home, at a party, or at a place of work. Abusers also report chewing immediate release products because they believe it gives them a faster and more powerful high.
And currently, although many products on the market may be formulated to deter oral abuse as well as other more dangerous routes, few sponsors have earned a label claim for resistance to abuse via the oral route. There are likely a variety of reasons for this, but in many instances, conducting an in vivo study may be impractical, overly costly, or simply unethical depending on the formulation. From a laboratory standpoint, the process of chewing or mastication incorporates both physical manipulation and extraction in saliva. A simulated in vitro method that mimics in vivo mastication was developed by the scientists at DRUGSCAN to bridge this gap and provide sponsors with a first look at a product's resistance to this simple yet effective manipulation and extraction route of administration.
Here at DRUGSCAN, we utilize the same technology that's used by regulatory agencies to conduct in vitro mastication studies for other products. This capability allows us to safely conduct studies without risk to human subjects or the inherent variability absorbed with in vivo studies, providing the sponsor with reproducible, reliable, and accurate information.
In designing the experiment, first, it is important to think of the bite forces in the context of the material being masticated. For example, the most effective mastication on hard tablets may be characterized by initial, soft compressions, while allowing saliva to soften the product, followed by cycles of median and maximum force intervals. The average human bite force varies greatly in the literature. One study on maximum human bite force showed high variability with large standard deviations between men and women of various ages. The lowest bite force were for post-pubescent women in a range of 80 to 218 newtons, while the highest bite forces were found in young female adults in the range of 286 to 404 newtons. Males of all ages fall in between these two populations.
Yeah, and another consideration, the variability of mastication endurance between individuals, especially over extended periods of time. To account for these variabilities, a variety of conditions are investigated in our studies to cover a broad range of bite forces and durations.
To fully characterize an abuse-deterrent product's resistance to chewing, DRUGSCAN's CAT.one experiments begin with an evaluation of dimensional tablet breaking force followed by simulated mastication. The apparatus used for simulated mastication is well established within regulatory bodies, academia, and industry. It consists of an upper and lower jaw positioned within a vessel holding artificial saliva, heated throughout the process at 37 degrees centigrade. The vertical up and down strokes of the lower jaw in combination with the rotating movement of the upper jaw provide ideal compression, a shearing force, and agitation to simulate in vivo mastication. These experiments capture bite force as well as API release over the course of the simulated mastication event.
And the data that's obtained from these in vitro studies may be used to support an application seeking an oral claim or to aid in the design of an in vivo mastication study.
If you would like more information for any of our CAT.one studies or would like a demonstration of our in vitro mastication experiments, please contact us at cat.one@drugscan.com.